Ebo mimafia iCCM na jitamako be michelaya oncha che ten wala be wo wina gbogba na afire lo asibiti ga wo tata turu gbambia etuna me lona de alimi cause na lachibe ya ejo aji dan community babonana meja tamako etachi ga ma fi asara ma fi to mitro na agwochibe na egwa gubaba e ba mboche jamfani bi oyina.
In 2013, under 5 mortality in Nigeria was estimated at 128 deaths per 1,000 live births, with approximately 54% of deaths caused by malaria, diarrhoea and pneumonia, illnesses that are both preventable and curable. Children under the age of 5 are particularly vulnerable and can die without access to treatment, especially in rural areas where access to the nearest health centre is difficult. Integrated Community Case Management, or iCCM, has been a recommended strategy to improve access to healthcare for hard-to-reach communities. Community health workers for iCCM are trained and supervised to provide timely and effective diagnosis and treatment of malaria, pneumonia and diarrhoea, as well as malnutrition. They are supplied with rapid diagnostic tests and artemisinin-based combination therapy for malaria, respiratory timers and antibiotics for pneumonia, and oral rehydration salts and zinc for diarrhoea.
Children are the heritage of the country. iCCM is like a complete package focusing on prevention and also focusing on curative. And I think that's what our children need so that we reduce the deaths among them.
The strategy of iCCM is meant actually to reach out to the places where the regular health services cannot reach.
The iCCM project is a lifesaver. It's one project that has helped to reduce the number of deaths among the children under the age of 5 and in areas where mothers are not able to easily access care.
As a mother, when I do not have money to be able to take my sick child to the health facility, iCCM becomes the most important to me. When these health interventions are brought to my house, knowing the challenges in reaching out to functional health facility, iCCM becomes very important to me.
In 2012, the Government of Canada awarded a grant to the World Health Organization to support the scale-up of iCCM in 5 malaria-endemic countries in sub-Saharan Africa. This initiative, called the Rapid Access Expansion Programme, or RACE, was launched in Nigeria in November 2013. Led by the Ministry of Health and working with partners, RACE was implemented in Niger and Abia states.
Lafiya lafiya egi gaje lafiya nke lafiya ya yi na je baba egi ne laudan yi re fa gba wa lokaci da gogari yayi na wa jerike be na cibe na bebe da eji babo na buna kam na cibe na la beji baba na egi no ci ngwa wa reshe na wa je cibe na ajere da be kamar daga na cibe na be na wa gwa kan nya jere o ci kan.
The whole iCCM initiative is an innovative program because it was born out of a need, and the need is to bring health services closer to the home.
The iCCM program is specifically to be delivered in areas that have no functional health facilities, those places with poor terrain, those places that are cut off from the primary healthcare centers. So for the implementation of iCCM, we have the frontline workers that we call the community resource persons. For the women who are community health workers in Abia State, you see them receive benefits such as they have social prestige, community approval, they have non-monetary incentives.
One thing that has come out of the iCCM project is the empowerment of the community to own and sustain the service that has been given to them.
The program is unique because it's involving both the community and the health system. But now we are taking on board linking the community with the health facility, because with the community resource persons, they manage the under 5 children with malaria, diarrhea, and pneumonia. And cases they cannot handle, they are referred to the health facilities. So the capacity of the provider at the health facility is also built to manage all those complicated cases. It is a collaboration between the community and the health system. And I think the time is right for that. The community needs to take ownership of their health and also utilize the primary health care center.
Oh, you so ko imagine ya bona daga na lati gbenna be daga agwo ya kutawo na yibani abuna ye jiwala ya asibiti bia e bona kafi ga idi asibiti abuna kam na cigbe la bia na o iso ye la gwanwo e gwa magbani na daga na cigbe na be na ha ije bo so ko e bo ka lokaci ne fi lokaci ba ko gwani da na ndo ci kaga cigbe na da bona ndo ce le la kafi ye dike fo gutana ye de fili ke bi ko ya amagbani ide cigbe na ije bo ya so ko ije bo ya za na ji la cigbe na be na.
Between 2013 and 2017, RACE in Nigeria worked with local government and partners in Abia and Niger States to deliver activities, including recruiting and training community-oriented resource persons and supporting the Ministry of Health to implement iCCM.
Without the Ministry of Health, both the federal, the state ministries of health, there would not be a good environment or an opportunity for RACE to thrive on. And so the ministry has developed guidelines, tools, provided the structure for actual implementation of the RACE project.
We've commenced the process to ensure that the 2 states under the RACE project developed a sustainability plan roadmap, and the roadmap has been presented to the State Minister of Health in Abia and Niger State. They now have the roadmap that will assist them to scale up the intervention in their respective states. We have scaled up iCCM to other parts of the country. So most states are coming on board to scale up these interventions.
As a result of RACE, healthcare services were strengthened. Almost 2,700 trained community-oriented resource persons have diagnosed and treated over 1.25 million cases of malaria, pneumonia, and diarrhoea.
I think the coming on board of the RACE project, it's good for the government of Nigeria, because before we make any policy decision, we need local evidence. In Niger and Abia, we now have a local evidence that this is the way to go as it relates to addressing the unacceptably high under 5 mortality rate in Nigeria.
RACE has been successful in Nigeria because in the areas where RACE has helped us implement these programs, the child mortality has reduced, and also it has built capacity of the communities. iCCM can work, it can be expanded and scaled up. The solution is simple. It's getting committed community members that could be trained and provided with the medicines and supervised regularly, and this could be delivered.
Right now, one of the best ways in trying to ensure that we improve the health outcomes for our people is through empowering communities to be more aware about their health, and that they can have solutions to these problems.
I have seen that intervention on health issues at the community level is yielding a very good result. Initially, I thought that a sick person should always get to the hospital, but in a resource-constrained nation like this, then other innovations like this, it's welcome.
Amfani machukoko na mi de na me loto ya zaji na mafari o afe ya mi ngichi lati bezo ke shinkafa on shi na ba chi o nga ya amfani chuko bididi na mi de etikata na to ya mi na gibani idani ngoda na.
Since its implementation in November 2013, RACE Nigeria has shown that iCCM is an effective strategy for reducing childhood deaths from malaria, diarrhoea, and pneumonia, and that scale-up is feasible. We need to ensure that iCCM benefits more communities in Nigeria and across sub-Saharan Africa. Leadership and commitment from governments as well as donors is crucial for this to happen and to continue to save more children's lives.
ma wona yewo chu bona je di udan bona ide la za asibiti ga lu asibiti ndo ma to baga so ga to dole yewo ma ya chi gbe ne bona to chi gbe so na mo ji ili upata wa lu asibiti ala ya wa ya na la nche le me guti jo ya igba ni je mu na la lo wa de se ke na la lo wa de so ke aka wa ji e bo ya za na elu ya wona pata ide bo ji e bo che gumi che de ji e bo ya ngeji to se ji lai